As we start today, we have some special guests here. I welcome all of you to join our briefing this morning. I'm going to start with our President and CEO, Mr. Jeffrey Flaks, who's going to start the opening today. Thank you.
Good morning. Today I'm excited to speak about really an important advancement for the state of Connecticut. We are announcing, and we will have our team speaking about the specifics today of our operation that we're inaugurating at the Connecticut Convention Center. We built, over the last several days, a 626-bed hospital, which is an Army field hospital. This is really an example of the tremendous partnership with the state of Connecticut, the planning, the strategy, the resources that have been brought here to this state during this time period, coming to fruition in ensuring that we're most prepared for whatever we may encounter. It also is a wonderful example of the tremendous capabilities of the National Guard. To see the precision, the commitment, the discretionary effort, the expertise of the National Guard, it really was awe-inspiring. The partnership we're creating is Hartford HealthCare will stand up and will operationalize and staff the convention center, which will have 626 beds in it. We'll use it for step-down patients, so patients who are transitioning out of the hospital, who are COVID positive, but need different levels of care. And it ultimately will free up more capacity within our hospitals. This convention center hospital we're building will be open to all people from all hospitals as necessary. We ultimately will have more than 1,000 staff members who will be coming in from divisions from across all of Hartford HealthCare, as well as volunteers, retirees, and people from the community who are stepping up during this time, who will help us operationalize our capabilities in this center. So this is an important advancement. Also, this Thursday of this week at the Central Connecticut State University, we're building a 200-bed hospital, again in partnership with the National Guard, and that will give us further capabilities. So in totality, we'll have slightly more than 800 beds online and ready to go as we go forward. So this is a tremendous advancement, and I just want to underscore the importance. It's about being ready. It's about being prepared. It's about ensuring that we have the right capabilities in place for anything that we could forecast and imagine. At this point, we likely will not be using the hospital in the immediate day or next several days. But as this crisis continues to evolve, this becomes an important point of flexibility for us and gives us the agility to put it in immediately upon need as we see the opportunity to transition patients into this center where it would be most appropriate. So I'm really pleased, again, just to underscore the partnership with the National Guard, their tremendous capabilities, and importantly, the state of Connecticut's support in this process, which has been working hand in hand with us. So we speak with the governor and his team every day, and they've continued to ask us what more they can do, how they can be more supportive, what we need on the front lines, and how the state can advocate and fight for resources across the country to help us in these moments. And this, I do believe, is one of the best and most important examples. I also want to recognize our tremendous partnership here with the City of Hartford. As we look at planning for how we take care of all residents in the city, and this is a regional initiative throughout all the regions that this city and the capital region supports. The City of Hartford has been with us from day one, continuing to work with us with our behavioral health resources, how we look to continue to care for the homeless, how we look to care for our caregivers in terms of putting residential capabilities in place within our college campuses, with our universities, and how the city can help us reconstitute other former centers in this region that could care for patients as we do this level of planning. And front and center of this has been Mayor Liv Bronan. I speak to the mayor every day. The mayor's been a tremendous advocate for his constituencies, his residents, the people that are under his charge in this city, and his passion, his commitment to ensuring that we're using all of our resources in partnership with the city has been absolutely outstanding. So it's now my pleasure to introduce Mayor Liv Bronan, who's been on site at the Convention Center and helped us put this in place and working with the state and the city together to make this happen. And I just ask you, we're going to release a time-lapse video. Just imagine building a 626-bed hospital in 7 hours. And it tells you the amount of coordination and alignment we have to have, and the great blessings we have by having a National Guard in this state that's capable and committed to do this type of thing. So it was an honor for both the mayor and I to be present when this was being built, and it is a remarkable, remarkable achievement to see it happen, and when and if necessary. My commitment is within Hartford HealthCare. We're going to staff this, we're going to stand it up, and it's going to be here for the residents in this region, in this community. Thank you.
Thank you so much, Jeff. Thank you to you and to the entire team at Hartford HealthCare. We are blessed in the city of Hartford and in the Hartford region to have incredible healthcare institutions, and Hartford Hospital and Hartford HealthCare are second to none in the country. They are an outstanding healthcare institution, an outstanding partner, and I'm deeply grateful to them. I'm going to talk a little bit about the center at the annex over at the Convention Center in a second, and I cannot say enough about the work of the National Guard. But first, I just want to put this in the broader context. There's discussion happening all over the country about when we may begin to ease the shutdown, or when various places are reaching the peak. I think we can't say enough right now that we're still right in the middle of this, that Connecticut and Hartford and the Hartford region are continuing to see an increase in cases on a daily basis. We're also continuing to see an increase in fatalities, and my heart goes out to every family affected by this virus. But we can't become complacent. And as Hartford HealthCare and all of our hospital systems are doing everything they can to prepare, whether it's through the expansion of hospital bed capacity, or by acquiring more ventilators, or by making sure that they have the staffing in place and that their staff are protected and cared for, or whether it's building partnerships with others to make all of that possible. We all have a role to play, every single one of us. And the most important things that we can do are still the simplest things. It's taking social distancing seriously, keeping physical distance between yourself and others, even when you have to go out and go to the grocery store. Wear a mask. Please wear a mask when you're in a place where you can't control how far you are from others, like going to the grocery store. And when you're doing that, recognize that it's for your own safety and your own health and the health of your family and your loved ones. It's also for the health and safety of all of those people who are out there putting themselves at risk, doing their job for the sake of the rest of us, whether that's our incredible healthcare providers here at Hartford Hospital and at institutions throughout the state, whether that's our firefighters and our police, our sanitation workers and DPW team, our bus drivers, our grocery store clerks. So many people who are out there working every day cannot stay home. And so we've got to try to stay home for them, and where we can't stay home, we need to take precautions for them. Because our goal is to do everything we can to make sure that as few of these beds that have been set up at the Connecticut Convention Center and that are being set up as CCSU ever have to be used. They're there if we need them. And I'm deeply grateful, again, to the Hartford HealthCare team, to the state of Connecticut and Governor Lamont for his leadership, and to the Connecticut National Guard for doing that work of preparation. But our job is try to make sure that we're over-prepared, not under-prepared. And the way we do that is by doing everything we can to slow the spread of the coronavirus. I really can't say enough about the Connecticut National Guard. As you can imagine, setting up a facility of this size in just a matter of days, the bulk of the work being done in one day, is an extraordinary undertaking. And to the men and women of the Connecticut National Guard, I cannot thank you enough. And I know we've got Captain Pytlik with us, who's over on site at the convention center right now. Captain, to you and the entire team over there, thank you for everything you're doing. Thanks for everything you've done. I know you are there standing ready, and we're all going to continue to do our part together. But thank you, and God bless.
Hey, thank you very much, Mayor Bronin. We really appreciate that. So I just want to say that we have been honored to be a part of building this surge capacity, especially here at the convention center. This is where we live. Connecticut Guardsmen are from Connecticut. We're born here. Our kids go to school with everyone else's kids. We attend the same places of worship. We are part of the community. So getting to be a part of building this tremendous resource and give this flexibility to our healthcare systems has been amazing. These men and women are very grateful to be here. They understand that, yes, they are putting themselves at risk, and they're worried about their families as well, but they understand they have a greater responsibility to help make our society more ready, to make us more prepared. And anytime I talk to one of these soldiers or airmen or militiamen, that's always the message is, hey, we get that it's dangerous, but we need to be here. So they're really doing their part. Talk a little bit about these beds. They're modular beds. They were manufactured locally. They came together very, very quickly, and these guys have set up these spaces all over the state, over 1,000 beds now throughout different healthcare facilities, long-term care facilities, convention spaces, colleges, and they're just very, very good at putting them together. But I want to emphasize that if you come with real mattresses, they are much more comfortable than like a disaster cot that you might get from FEMA. These are meant for real people should they have to be used. They're meant to genuinely provide dignified care to people should they need to recover somewhere other than home, whether they're not ready to go home because they're still receiving treatment, or because maybe they just don't have a home they can go back to, or they have people in their home that are immunocompromised and maybe they can't return. So it's just been absolutely amazing. And it's not just the bed space that we've been building. We're continuing to distribute personal protective equipment to the different regions around the state, to the different local health departments. And we continue to distribute ventilators. We pushed out 98 ventilators yesterday. Nearly 200 have come in. We're preparing those for distribution today and tomorrow. So thank you so much to the state for allowing us to be a part of this and to help contribute. I think it's a once-in-a-lifetime challenge, and a lot of these people will remember this for the rest of their lives. I would just like to now kind of pass it off to Dr. Prete, who will maybe talk a little bit more about how this space may be used.
Thank you, Captain. First and foremost, I'd like to thank all the members of the Connecticut Army National Guard, Air National Guard, for their unwavering support and dedication putting up this hospital, the 600-bed hospital, in record time over the weekend. It really was remarkable to see all these efforts come together in partnership with the state and the city. As a fellow Air National Guard member, I was really proud to be standing with them. Another member of my team, Sean Bronin, who's also a member of the Hartford HealthCare team, is a colonel in the 103rd Fighter Wing in Connecticut. So we were really proud to be standing with this team together. This annex facility will be operational and staffed by Hartford HealthCare nurses, RNs, PAs, and support staff. The mission really is to utilize an alternative site in case we need to open beds that outstretch our infrastructure at Hartford and the surrounding hospitals. The population that we're going to serve, I'm going to go into a little bit more detail, but we're talking about COVID-19 patients who have been treated and are convalescing from their acute illness and may need more time to get well and do not have a home or an alternate site to go to. Also, COVID-positive patients who have have entered our system and need care from an acute illness, but can't be admitted due to other circumstances because of our needs. We also have the ability to take patients who may not need to be admitted, but need to go to an alternative site because of other circumstances beyond their control. We continually monitor and update the surge modeling and try to predict the needs of the populations I described. At the same time, we're preparing these beds with clinical workflows, building our infrastructure, bringing in oxygen, bringing in our electronic medical record, and connecting to our care logistics center. So we are proud to begin this process. We will be ready when the need comes. It's hard to predict that need, but we'll be ready if that circumstance arises. I'd like to turn it over now to Dr. Ajay Kumar, the Chief Clinical Officer.
Thank you, Mark. Thank you, Mark. It's inspirational to see when teams come together, what all we can achieve in very short time. So with that, I'm really grateful for the state of our governor and mayor and our leadership, Jeff Flaks and National Guard and Dr. Prete's leadership in making this happen, preparing us for what hopefully does not come, but if it comes, we're prepared for that. So with that, I'd like to update some of the details about individuals we are caring at this time in our facilities. We have 386 patients in our across the system who are in acute facility right now, recovering from COVID positive status. Bacchus Hospital has 8 patients. Charlotte Hungerford has 20 patients. Hartford Hospital has 181 patients. Mid-State Medical Center has 29. St. Vincent has 102 patients. Hospital Center Connecticut 41, and Wyndham has 5. We have 24 patients added to our system with COVID positive in the last 24 hours. We continue to see the similar kind of trend, about 8 to 10% increase in our volume. of COVID-positive patients. So as Mayor indicated earlier on, we are still not out of the woods. We need to continue to focus on hand hygiene, social distancing, wearing the mask in the appropriate places, and avoiding unnecessary travels and gatherings where it's possible. With that, I'm going to open for any questions or comments anybody has, and we have got an entire team here to answer the questions.
Hi, this is Sierra with the New Britain Herald.
Hi, Sierra.
I have a question about the CCSU capacity. Can you guys talk a little bit more about that and the setup and what you're going to use it for?
Dr. Prete is going to take the question.
It's Dr. Mark Prete again. Thank you. The Central Connecticut University will have the capacity for about 190 to 200 beds, a very similar structure as we built in Hartford Convention Center. And so that is the capacity as we see it standing up this week.
Used for similar.
What part of the campus did you guys put that in?
It's going to be in the field house and then the adjacent basketball court.
And my other question was back to Mr. Kumar with the numbers. The positive in the whole system, is that a different number than the 308 you gave in the beginning?
The total number of positive COVID positives, 386 in our acute hospital at this time.
All hospitals.
All hospitals.
Okay. All hospitals.
Yeah.
And can you just keep with the numbers, can you give the PUIs?
We have 82 PUIs across the system right now, and this is not including a behavioral health or community network. We have several more there, but 82 in acute hospitals.
Okay. And my last one is, do you have any numbers for the ventilators of the recovered patients?
Yeah, we have over 121 patients who are recovered from our system in the last several days, and ventilator, we are still doing very well. We have about 110 ventilators used for COVID-positive patients across the system, which is, and if you include all the PUIs, we have a bit more. We are ranging about 40 to 45% ventilator capacity at the moment, so we have, we are in a good place right now with this capacity.
Okay, thank you so much.
Thank you.
Hi, good morning. It's Bridget from. Sorry.
Go ahead.
Go ahead.
You can take a turn, that's okay.
I'll go ahead. All right. No, sorry. It's Bridget from the Republican American. Good to hear Dr. Prete. Hello again. Given that it is very hard to predict the need, and now we're hearing some good news of leveling off perhaps, and also talk of reopening parts of the economy on a national level, how do you see the numbers projecting out to the use of these facilities, and when might that start?
Thank you. That really is hard to predict, but if you look at what's happening in other states, as the hospitalizations level off and the number of cases that are in the ICU level off, it does not mean that the community need will go down. So if you look at the patient population that I was talking about, you have patients that have already been treated and are convalescing in the hospital. If there's increased demand for admissions, that may require us to have an alternate site for those patients to go to. At the same time, if we have a second surge in 2 weeks, then that would require potentially on the admission side that we have patients who need alternative site for observation that meet certain exclusion criteria. So there's two sets. It's on the inside being admitted, and then on the discharge side.
Mark, can I just add to this?
Okay. And I do understand each patient is different, their needs are different, but is there any sort of an average of hospitalization stay for a seriously ill COVID-19 patient?
You know, I just want to comment in your previous question first. We are still seeing 10% day-over-day increase in our volume of patients actually who are coming to the hospital. So I do want to emphasize the fact that we're still in the incline of the curve here. The rate might differ day by day, but it's still in the incline here. We've not seen the peak yet. And what preparation we're doing with the National Guard and the partnership of our city and our Hartford HealthCare right now is about being ready for the times when we need to act quickly at this time. The question you're asking is regarding what is the duration of the patient on average stays in the hospital who's COVID positive or PUI. That's an interesting one. We're monitoring the data very carefully. Generally, we have seen, and it's very difficult to predict right now because the spread of the patients could be, depending on certain age groups, the numbers vary quite a bit. But generally, we are seeing about 7 days of total average duration. Now, that includes individuals actually who get better very quickly and go as well. But generally, in ICU, we see a more than 10 days length of stay for patients staying. So, still, this is a deadly disease. This actually has a high mortality, and it's all the reasons for us to be prepared as we are getting ready right now.
Dr. Kumar, this
Yep.
is Alex from the Hartford Current. You talked yesterday a little bit about antibody testing. I'm just wondering, do you see that as eventually being something that's rolled out on kind of a mass scale where, thousands of people are getting those tests? Or is that the type of thing that would be targeted more specifically or used for research purposes? How do you envision that?
Yeah, so I think I talked about 3 components yesterday as epidemiology, as a society, how we need to react to that. One is that a lot of testing, and just the testing of COVID positive patients. The second is contact tracing, our ability to be able to do the contact tracing. And the third part is antibody testing. Antibody testing, depending on the availability, should ideally be applied to large scale as much as possible. Our intention in Hartford HealthCare, within a short time, we should be ready and we will implement as much as we can as the test kits available. But our goal would be to offer the test to all the healthcare employees, colleagues across the Hartford HealthCare. This is a mass testing effort which is going to allow us to be positioned differently as we think about coming back to the workforce, opening economy, and so part of the organization.
Can you talk about plasma donation, which is happening today?
Thank you, Rebecca. One of the questions which I've been asked regularly is about the convalescent plasma and donation and the use of that. I'm glad to announce today we have a donation happening of one of our patient who's donating plasma at 12:30 today. And this would be used for some patient depending on the clinical status. And we've already have several donors registered through our system, and we'll be ramping up this process very quickly. But this is a very important day for us to be able to have that possibility ready, as I indicated several times in the last week.
So on the antibody testing, one more question. So I know there's still some question about to what extent it truly gives immunity and for how long. How close do you feel like you are to having those questions answered to the point where you're comfortable using these tests and making decisions based on them?
Yeah, science is still evolving, as you know. What biggest concern you have antibody testing is about the false negatives. You wouldn't want to have those things happening. Generally, if somebody's positive and the test comes back negative, you can actually create a challenge for that situation. Our understanding, based on the latest science right now, the immunity which comes about, IgM, which is one of the earlier immunity within 4 to 6 weeks, and IgG, which is long-lasting, should provide immunity to patients. But I do want to underscore the science is still evolving on that part here. This is the right tool to have in the toolbox with other tools we have. But this is going to be studied over the time, and we will study and adjust as needed as science evolves in that.
Thank you.
Any other questions?
Hi, this is Liz from Hearst Media. I am wondering, you mentioned 121 patients recovered. Is that total discharge numbers of discharged COVID patients so far, or can you speak to any trends you're seeing in that regard so far?
Yeah, so, the discharge, when we talk about the transitions, we like to call in Hartford HealthCare, of the patients actually who are leaving our healthcare facility, we describe in multiple different ways. One is that the individual coming to the emergency room observation, and they're being transitioned out. One is inpatient. What I gave you the number of the inpatient, these are the sicker patients actually who are admitted to our facilities and then leaving. And that's a celebration, quite frankly, of 120 people who recovered. It's a wonderful thing. But we have more than 400 people who actually came to our emergency room observation status across the system who have recovered and have been transitioned out of the community. So the numbers are larger, but I'm giving you the number for the inpatient status. It's all the nuances about how we look at the data. But I'm hoping over the next several days, I'll provide a bit more discrete data as we go forward.
And Dr. Kumar, just to clarify, you did mention, and I don't think I heard you well enough, you said Winstead Medical Center had 29 patients?
Midstate Medical Center has...
Midstate, okay, not Winstead, all right.
No, Midstate, I'm sorry, Midstate. Midstate has 29 patients, yeah.
Okay.
I need to remind everybody what is a part of Hartford HealthCare once again. Should I go over? I'm just kidding. That's okay.
Hi, Dr. Kumar. This is Daniela Johnson with WTIC. I just have two questions. The first is really a clarification. The field hospital at the convention center is, I'm assuming, is now operational, but I've heard that it's not, no patients are actually in there and won't be there for a couple of days. Is that right?
I'll let Dr. Prete answer this question.
The field hospital the infrastructure is built. We have not opened it up for patients. We actually plan on Monday to test it with clinical workflows, bring our staff in, and make sure everything is right. And then we'll be ready if we need to have patients in there in a couple weeks.
Okay, thank you. And the other question I had is, and it may be too early to really comment on this, but there has been talk about a possible resurgence of this virus in the fall. Is this kind of field hospital, are we going to be using something like this if such a case would happen? Would this stay open, or are we, when the state reopens, is it going to close down and we would have to set it up again? Has that been given any thought?
We have not looked that far out. I would say that we're looking weeks ahead right now, and if the need arises, then we've learned a lot and we can always do this again. That's how I would probably frame it right now.
Thank you.
Lisa Carberg at News 8. Dr. Kumar, can you give us an update on plasma, please?
We have one patient who's donating today, and we would have this capacity on large scale very soon. We've registered several donors through our Hartford HealthCare website, and our website has an updated page for donors to visit and understand about the convalescent plasma and how the donor activity works. We're working with American Red Cross, we're working with Rhode Island Blood Center, and in New York-based Blood Center at this time. 12:30, we have one individual who's donating today. Yeah, and that's a really important step forward for our healthcare organization to be able to have the capability in our toolbox to care for the patient. So we're very proud of that. Our team's been working day in, day out to make sure that that gets ramped up very quickly.
Can you give us any more details about how the plasma works? I'm asking for a medical reporter.
So plasma actually is a collection of antibodies, and it actually allows, it's a different type of antibodies from a recovered individual who actually had an infection, who's recovered already. We test them, make sure they don't have any active infection. We take the plasma out. It's processed in such a way the outcome of that is concentrated antibodies, and they're introduced to the individual who's actually very sick and some of critically ill patients, and then it helps boost their immunity to fight the infection. It augments the process of our response to the virus.
And we will share the link to the donation site immediately after that.
Thank you. And Rebecca just reminded me, we will share the link of the donation site after this detail. Then I would encourage all of you to share the link widely. This is an important thing for our community to come together and help create the treatment option on large scale.
And Dr. Kumar, Bridget again. Could you comment about, there seems to be more of an opinion that we can think about reopening, we can think about getting back to a partial functioning economy, and there's quite a bit of talk of that. How much does that risk where we have and how well, relatively so, we've done with social distancing?
No, I think as we have discussed before, we continue to predict our modeling, based on our modeling, is that we're going to see a uptick in the cases all the way till end of April and early May. So we are not out of the woods at the moment. I think the opening the economy has several different factors which needs to be put together. One is the widespread testing, the contact tracing, the antibody testing. And quite frankly, I think we needed something on the horizon, the vaccines or the treatment options, which are still in development here. Now, as the state evaluates the process, as our healthcare leaders and clinicians come together and planning that out, I think we would have a bit more understanding over the time. But I don't think today we can comment on when the economy should be opening. But over the next several days to weeks, I think we should be in a better position to at least make some assumptions at this time. Mary, you want to add something to that? Thank you.
Thanks, Ajay. I just want to address that really quickly because I think it's so important for us to recognize that we have not yet reached the peak here in Hartford and the Hartford area and central Connecticut as a whole. Now, we continue to see the number of cases climb. Here for just the city of Hartford today, we're looking at about 421 confirmed cases. That's up significantly from a week ago. And the pace we're seeing, I believe, has us continuing to double on about a weekly basis, week to every 10 days. So we're still in the middle of an increase. And while we should be planning, and I commend Governor Lamont for working collaboratively with governors around the region and around the country to think thoughtfully about how that reopening happens when it does, I think he also has been pretty clear, and we all need to be pretty clear, that we're not there yet. We are still in the middle of battling this pandemic. We're still in the middle of the collective effort to slow down the spread. And right now, we are still on the early part of the curve, the first part of the curve, where we're still moving towards the peak. So we've got a ways to go. And I just think from it's so important from a public health standpoint. It's so important that no matter what conversations are happening, we all stay focused on taking the steps we can take individually and collectively to slow down the spread, to keep the peak as low as possible, because we're a while from being out of the woods here. Thanks.
Thank you, Mayor. Any other comments, questions? Tina, anything on the Facebook? Well, there are no further question. I again want to thank our partnership with Mayor and Mr. Flaks' leadership, who's really been leading the charge for us, and all the work our National Guards and Dr. Prete and other individuals are doing here. I do want to make sure that you remind everybody about visiting the plasma donation site on our website. We'll send you the link. Our webpage has a lot of information. Our call center is still open 24 hours. We're serving in excess of 2,000 patients and community members every 24 hours. Our website provides a tremendous amount of information. And while you write the media articles, please do thank all the heroes in the healthcare industry, not just the Hartford HealthCare, but across the state, who are doing a wonderful job, from the emergency EMS providers, from individual in supply chain, the physicians, the nurses, and the pantry workers, and all those individuals, the respiratory therapists, and I can go on with the names. These are the people who deserve a true recognition. And as Hartford HealthCare goes forward, our commitment to our colleagues and safety will be strengthened, and we'll be talking more about it in the next coming days. Thank you very much.